Welcome to Medicare Part C, presented by OneSource Financial Advisors. In this short video, we'll explore the origins of Medicare Part C, otherwise known as Medicare Advantage, how private insurers provide coverage in coordination with Medicare, the potential costs associated with it such as monthly premiums, co-pays, and deductibles, along with a review of its benefits and limitations. We won't be able to cover every minute detail, but it will be thorough enough to encourage proper consideration. So let's begin. Medicare Part C was designed to protect and extend the financial integrity of Medicare by leveraging the efficiency of private insurers to reduce costs. And even though a limited number of insurers originally participated in the Part C program when it was formally introduced as part of the Balanced Budget Act of 1997, the program still saved taxpayers money. Part C gained momentum among private insurers when changes were implemented by the Medicare Modernization Act of 2003, introducing Medicare Advantage plans as we know them today, along with prescription drug plans. Participants who select Medicare Advantage plans still have Medicare coverage, but their Part A and Part B benefits are provided by private insurance companies instead of original Medicare. Don't worry. These plans are funded and strictly monitored by the Centers for Medicare and Medicaid, and in order to be compliant, they must adhere to Medicare's rules, providing all the services provided by original Medicare. In addition to the core benefits required by law, however, most Advantage plans also bundle services like vision, hearing, dental, and other health, fitness, and wellness programs. They also often include prescription drug plans, which is probably what increased their popularity. One of the ways private insurers can afford to bundle additional benefits beyond what original Medicare provides is that they deliver their services through physician and facility networks like health maintenance organizations known as HMOs or preferred provider organizations known as PPOs. HMOs typically restrict care to in-network physicians and facilities within a plan's geographic region and require referrals for specialists. Whereas PPOs don't usually require specialist referrals and often allow for out-of-network care at the discretion of the participant, but usually at a slightly higher cost. Some insurers also provide other Advantage plan alternatives such as private fee-for-service or medical savings account plans. Each Medicare Advantage plan has pros and cons that we're happy to help you explore, but two important considerations are whether to choose a plan that includes prescription drug coverage or whether you plan extended periods of travel away from your primary residence. If your Advantage plan doesn't include prescription drug coverage, you may not be allowed to sign up for a separate prescription drug plan, which may lead to potential penalties if you want or need a prescription drug plan later. For more information about potential Medicare penalties, please watch our Biggest Mistakes to Avoid video. If you plan to travel extensively, say as a snowbird with multiple residences, please be aware that some plans will not provide non-emergency coverage outside the regional network servicing your primary residence. Anyone can select a Medicare Advantage plan instead of original Medicare when they first become eligible for Medicare, but it's necessary to understand the limitations that accompany the expanded benefits we just discussed. If for any reason you decide you want to cancel your Advantage plan or switch to another insurance company, you can only make changes during Medicare-approved times. October 15th to December 7th is the annual enrollment period when you can join, change, or leave Medicare Advantage plans. You may also leave Medicare Advantage and return to original Medicare between January 1st and February 14th. During the remainder of the calendar year, however, you're locked into your coverage with the exception of 5-star plans or individuals enrolled as dual needs, receiving both Medicare and Medicaid. It's important to understand that although Medicare Advantage delivers coverage through a private insurer, you must continue paying your original Medicare premiums. And because private insurers often include additional services like hearing, vision, dental, and possibly prescription drug coverage, some Medicare Advantage plans charge a monthly premium in addition to your original Medicare premiums. Since each plan bundles services differently, Medicare allows insurers considerable flexibility regarding how they manage out-of-pocket expenses like deductibles and co-pays, and how they administer coverage for prescription drugs, but each plan provides an annual maximum out-of-pocket expense ceiling. You also need to be aware that Advantage plan providers can change these rules annually, so it's important to read the evidence of coverage and annual notice of change the plan provides each year. If Medicare Advantage plans sound complex, that's because they are. But we're more than happy to answer any questions or concerns you may have regarding Medicare, Social Security, or anything else related to a successful retirement. So please call OneSource Financial Advisors at 520-686-7783 or email us at admin@finance.onesource.cloud. Thank you for watching. To explore what Part D covers, along with its limitations and potential copays and deductibles, please click the link for our prescription drug plans video. You may also want to view our videos regarding Medicare supplements, how to enroll and disenroll, and the biggest mistakes to avoid.